Now, having so many leaders of digital health, I'm really honored to have you all here. All the stars aligned, literally. Here we sit. Maybe.
I don't know why you invited me. Shall I go then?
Maybe Dan, you start because you didn't have the opportunity. You're presenting tomorrow on the startup stage. Sure. Because you came in a little bit late. But yeah, okay, tell us quickly about Medopad, and then we are going to open up the panel.
Sure, definitely. Medopad is a digital medicines company. We complement different treatments for different diseases, mainly chronic diseases, and doctors use our applications configured the way they want it for their patients cohort, and we can connect the devices from Apple Watch to your pacemaker, and the data go to the clinical team, and based on that, they can adjust your treatment or intervene earlier. That's kind of where we started as a core. But recently, as you might know, about a year ago, we did a big partnership with Tencent, and we are adding intelligence together on top of different diseases to be able to predict complications, to be able to predict the deterioration of patients. We recently launched our work about Parkinson's, the outcome of that technology we developed, and slowly we are adding more and more diseases, which is quite exciting, and that's kind of like in line with our long-term ambition of what can we do to help patients to live extra 5 years, extra 10 years, extra 15 years by being proactive about their care and enabling them to have a better, basically, lifestyle.
Okay, thank you so much. So digital health is not equal digital health. They're all different models. Some work like Telepaxx, and you work more with the hospitals. I think you are working more with the medical system. You get reimbursed as a patient, so your insurance company is paying. Ali, what is the revenue model, the business model of Babylon? Who is actually paying at the end for the service?
So whoever pays for healthcare pays as in any geography. So in UK, it's the government, it's the National Health Service in Britain who pays for it. We have now, I think, 4% of London under the age of 40 is on Babylon. We are their GP. The Secretary of Health now said that they will let that grow to the entire country. In United States is insurers that will pay normally, or the employers. In Asia, there is a lot of self-paying that goes on.
Babylon is part of that healthcare, the local healthcare systems, and it's embedded in it. How is this with Zava? Is a patient paying, or is the insurance company paying? Speak up a little bit, please.
It's a premium service, which is self-pay. So if you use the service, you would actually pay at the point of care. And we're currently also in pilot stage with insurance companies and statutory healthcare providers in Germany. So they pay, so it's free at the point of care for patients.
Yeah, because I think there's always a great need to get a second opinion, right? I had knee surgery with my meniscus, and I would have loved to send the x-rays or the MRI to another doctor, and I think I would have paid for that. So I think KRY is one of these companies which came out of Sweden. When you're now going to the other markets, France, the UK, tell us, Johannes, what is your experience? How open are the healthcare systems to employ such an innovative service? Because you're going in the Western world. I think Babylon is doing a great job in the emerging markets, and you're probably also coming, of course, to the Western world also. But from Sweden, I think you have a penetration. How many people in Sweden are using KRY?
So roughly we serve 4% of all primary health care is taken care of by us and our doctors. But to your question, I think it's changing a lot, and I think it's changing rather quickly. People are rather open to digital care, and then of course it's a rather conservative business. It's a lot of
Excuse me, speak up a little bit. Sorry.
It's a rather conservative business, and as with all businesses, there's a lot of people with a vested interest in making sure that change do not happen. But for governments in Europe, I think everyone do understand that it's increasing costs within healthcare. It's low accessibility. You know, you have medical deserts spreading in many areas where you have no or very little access to healthcare, and you know, you need to structure things in a different way, and we're the answer to that. So I think it's changing very quickly, and the whole of Europe is starting to open up for digital care.
Okay, so what is the typical flow of the product? I have some problems, some health problem.
Yeah, so let's say you have a health problem and you download our app, and we're a strong consumer brand, KRY, in Sweden, so you know about KRY, and then you download it on iOS or Android, and then you start with describing your symptoms, and then you get matched to one of our doctors. We make sure that you see the right level of care, and then within a few minutes, a doctor will usually call you via video within our application, and from there, he or she could prescribe medication, send you to a specialized clinic, give you a sick note or advice or whatever you need.
Because there are also the physicians' apps, like Doc Planner, Dr. Lib from France, and they get paid by the doctor, or in some cases. But in your cases, it's a reimbursement system, it's a hospital, it's a patient for premium. You're differentiating from the other apps.
Yeah, for us, like our end consumers is the patients, and then of course, like we have our platform for the clinicians, but it's for our clinicians to use, but we're not the software as a service for clinicians to sign up. Like we are a platform that way, but we're a controlled platform. We employ our own people and our own suppliers, so to say.
Okay, since we are an investor conference, I think any investor will ask themselves, okay, this healthcare space is super interesting, it's yet to get disrupted, but what is Google and Facebook and Amazon doing? Are you worried that these big giants are trying to launch healthcare products? Have they already?
I'm not very worried. Certainly not at this stage, because it's not, healthcare in Europe is not one market. These are very different markets. And I think what Johannes is describing is you can unlock Sweden, but then you need to probably a different strategy how to unlock Germany and in the UK. So it's not a winner-takes-all market, at least not from my perspective. And obviously we're looking at what they're doing, and Amazon kind of is making first steps in the US, medicine delivery, partnerships with kind of Berkshire Hathaway, but it's, for now, it's yet to be seen what they're really deploying.
It's a lot of red tape in Europe, I guess. They have to work themselves through, and it's different from country to country. Maybe Rainer, you know the German market quite well.
I think most of us really know that the German market is a very difficult one. So we have very strong legal regulations. At the years before, and now with GDPR, it's becoming really a little better than before. It really sounds stupid for other European countries that it is a good situation for us, but it helps really. I think this is one of the main problems, that the regulations were not the same all over Europe before, and this stops a lot of investors, a lot of hospitals buying foreign solutions because they are not sure what legal situation is there, and they don't want to make something wrong, and so they keep their old shoes, I would say. And
is regulation the biggest inhibitor for your growth?
It's a big one. For us, it is really a big one, because we have a platform idea now how data archiving should work, and what is allowed to do with the data afterwards, and whom we have to ask and whom not.
Because super interesting. I think there's this Israeli company which we had at NOAH Tel Aviv on stage, Zava Medical.
Yeah, Zava Medical is one.
And they're using computers to analyze the X-ray images, and then they are with a 98% accuracy versus the radiologist, which is the 70% accuracy, giving a diagnosis.
Yeah.
While this is allowed in America, I think in Europe, you have all the X-ray images stored for the hospitals, and there's a legal or regulatory barrier that you're not even allowed to apply AI to the images.
Yeah,
is that right?
We have two barriers. We have the first one is using these images, or we had using these images, because in the years before we had no real regulation. With the German data protection law, it was not clear what to do and what not to do. And in the end, they always come up to you and say, ask the patient. If the patient admits, then everything is fine. It's unusable to make AI.
So you have to get an opt-in from a patient.
Yeah. And the second thing is really that artificial intelligence classifiers must follow some rules here. They must get a CE label. That means it is a medical product, the same as the software inside a MRT or a CT. And this is also a very hard job in this moment, because we have this classical IA idea, data in, black box, output. And this black box inside is something you will never get a CE label for it. So
Okay.
we must also work through new ways to get these regulations. It's not hopeless, because the US really shows how this can go.
Yeah,
The-
Europe
the-
is just following
Yes,
you guys. It
FDA, they were the
just takes
first-
some time.
Yeah.
We tend to be slow followers.
Yeah.
Let's see how big we are. Like in terms of number of patients, or you said 4% of the Swedish population. That's already hundreds of thousands of patients. How many use the app on an annual basis, roughly?
We do roughly 500,000 consultations.
Half a million. It's quite a lot. And in Zava, you had like 1 million.
It's just under 1 million this year, yeah.
And Babylon, is it a number you can share, or is it?
Yeah, of course we can. We do the same number, around 500,000 physical consultation, but more importantly, we do about 3 million AI consultation, because you have to come through AI first and then get to us. So today in London, in UK, we will do about 3,000 AI consultation in UK and United States, and we will do about 500 face-to-face, 1,500 to 2,000, depending on thing in Rwanda.
And face-to-face means screen to screen.
No, it means a screen to screen.
Screen to screen.
But you need to remember, we are now in 20% of all mobile phones in Samsung, 10 million Samsung phones, we are part of the operating system, and 70 million Samsung phones in the United States, we are part of the operating system. If you go to your Samsung, you go to Samsung Health, Babylon is the operating system behind Ask an Expert with our thing there. You mentioned about revenue, and I think that is important, because you had my friend Michael here from Com,
Michael Atkins.
and Michael kind of showed that you don't always need to get revenue from the old sources of revenue, right? So I don't know whether it's true or not, but Forbes published an article about us the other day that we signed a $100 million deal with Prudential in Asia, the largest license fee, if it is true, the largest license fee ever paid for AI in any sector in the world, right? So I actually think that this idea of constantly going out there, raising more and more money to build more of your business, it's kind of like a Ponzi scheme, isn't it? Like I lose money on a thing, I buy a pair of jeans for $20, I sell it for $10, but because I got a lot of use, I make more. I think the truth on healthcare is going to come, can you deliver a better service profitably? Can you deliver that at lower prices that it costs the system? Can you do capitated primary care or secondary care, where you take all the risk and you deliver to the systems? I think those are the questions that will define the future of healthcare. Otherwise, we can all go and pretend that we are, raise more and more money. I mean, Ponzi
For
schemes
us, for
will...
example, like we act under many different models. We act under capitation models, we act under action-based models, we do private pay, we do insurance pay, and then it's just solving the problem for the patient, right? Yeah, that part is infrastructure, making sure that we can run a business on it, but in the end, it's about solving problems for
But
patients.
you agree with that, right? It's all about profitability of the underlying businesses, right? And if healthcare companies are going to survive, digital healthcare companies, we saw that game in e-commerce, right? You and I were at Goldman together. And e-commerce at the time, there was a lot of people selling a pair of jeans for $10 that they were buying $20. And all of those disappeared. And the people who survived were the likes of Amazon, who figured out the underlying logistics, economics.
Yeah, but
this is not technology
No, but,
business.
Of
This
course,
is-
and in Sweden, for example, to take that as an example, we did roughly 2.5% of all primary healthcare last year for 0.6% of the budget. Like, of course, we are way more efficient than a traditional system. And, yeah.
And how much is trust an issue? When it comes to health, you really want to trust that the person who's treating you is the right one.
Yeah.
You kind of have the authority by the hospitals. These three guys over there, they're kind of on their own without the hospital, but connecting the physicians and the patients, having AI and good capital raised and size and as credibility. How important is it for Medopad to have the hospitals as a partner?
I think one of our company values internally is like we call it trust defines us, because without the trust internally, but also with different partners, whether it's a patient or the doctors, we wouldn't be able to achieve what we need to deliver. In a sense of our business, we are a little bit lucky because doctors from the departments comes to us, they configure the solutions and modules and kind of created digital medicines for that specific disease, and they prescribe it to the patients. And because that doctor touch is there, it's much easier for the patients to subscribe to it, use it, but also they're ultimately trusting the doctor. And as long as the doctor trusts us, we are in a good place. And that has been, as you might know, we haven't actually raised any big money until very recently, which we raised about $30 million. And the only way we managed to grow was one doctor from one hospital liked it. They recommended it to our colleagues in the US. We signed Johns Hopkins. Another one from Hopkins liked it, introduced us to somebody in China. We got a project there. And that
you get the authority through the doctors and
yes,
the hospitals.
working with key opinion leaders, because again, we as a core business started with rare, complex diseases. We didn't start with diabetes or other initiatives. We started with complex
And why
diseases.
is that? Because they're difficult to find the experts for, or?
Why we started with rare diseases? I think we kind of, although it might sound very smart if I say that we kind of had a strategy, we didn't have a specific strategy for rare disease. We kind of got into that space by chance, but it happened to be the best thing that happened to us as a company, because with rare disease doctors, you can get a buy-in easy. You only have one stakeholder. For general diseases, you have multiple stakeholders. For some of the initiatives around GP, you have to have like 10, 20 different stakeholders all in the room, and getting them in having one meeting is really hard. We kind of got into the hospitals with one project. Roll-free is a good example. And now 2 years later.
You went for the odd one, and then you go to the masses. Ali, I have one question for you on AI. And Klaus gave this presentation this morning about partly AI. Now, what is the AI in the context of your company? What is AI doing for the health product you offer?
So what we do is that we get artificial intelligence to diagnose a disease.
Through images or?
No, through a chatbot conversation. So if you think about what happens with us, is half of our patients, 40% of our patients to be precise, do consultations with the AI and figure out they don't need to talk to a doctor, or they should go to a pharmacy.
And that's the interest for the insurance companies to reduce the number of visits.
Now, of the ones who come to us, we have a portal for our doctors who will take the summary of that AI, and we will launch that thing. And so we're doing it in trials, but we will launch it in March, where we will then, the AI is going to tell the doctor what the diagnosis is, so the doctors can then go on top of that, ask complementary questions. So what we've found in trials is that we can reduce the size of the consultations, well, the timing of the consultations by about 30–40%.
Oh, wow.
And then the AI writes all the notes, which is about 20% of what the doctor's time does. 40% don't come, 30% time is saved by the machine helping the doctors, 20% doesn't go. So our cost of delivery end-to-end is 70% less. In any business that you have a 70% cost advantage, you could do a great job. So what do? We give that service back, for instance, to NHS in Britain. They pay us for 50 hours of service a week, which is 8 hours a day. But we provide 24 hours, and we do it 7 days a week, non-stop. The average waiting time is a week to 2. The average waiting time for us is in a few minutes, but we don't charge extra on the top. We don't go to GPs and say, now for this consultation you have to pay more. We become your GP. It's all part of that same capitated fee. And as you can imagine, now think about this in the context of the United States, where actually, your point about...
Who is in the US market at the moment? And who?
So in the US market, you have telemedicine companies galore, right? I mean, everywhere there must be 50 telemedicine companies. In the artificial intelligence end-to-end provision that you can take a capitated risk, because it requires also a significant amount of capital. Capitated risk, there is not that many. I think, by the way, your point, by the way, where is Europe compared to Asia and thing? I think, unfortunately, Europe is a long, long way behind. It's a long way behind, not just on regulatory, as you quite rightly say, but it's a long way behind in the ability, in the decision-making, in desire to adapt, both from governments and from insurers. Having said, I think our British government is doing phenomenally. I think Swedish government does very, very well. But they're not And also, Europe is very fragmented. Like if you go to Italy, it's 15 different, 16 different regions. They each have their own regional things.
If you take, we're the 3 biggest probably in Europe, and in total we probably do between 1 and 2 million consultations, video, AI, efficient doctors. In Germany, there's 1 billion consultations every year for the entire population.
But isn't that upsetting? Because as a consumer or as a patient, I'm upset that our government or regulator has, I mean, after 10 years, we know each other for 10 years, have still not managed to deliver to me through the technology which is there, through the content is there, through the capital which was raised, to deliver the product to me. I mean, it's not like Uber, where they can kind of drive you and, you know, there are some issues later, but
does it have to be governments delivering it? Like we're private companies delivering those kind of services, and we're just getting started.
But when they don't allow you to get like an AI consultation, or if they don't allow you to get reimbursed in Germany, I think.
Yeah, but that's also part of the business. There were no one allowing our type of services when we entered Sweden, for example. There were not like
so
a
how is
model
it working
for this type of care.
what is the core product in Sweden? So you have to speak up a little bit.
Yeah, the core product in Sweden, you know, I described the usual patient flow, but as mentioned, like, there were no one willing to pay for our type of
but
services
is it all
when
diseases?
when we
is it
entered.
just
We focus mainly on primary healthcare, so we focus on primary healthcare and also psychology, but continuously to expand the offering that we do.
and do you see a scenario where KRY will be like the 20-30% adoption in Sweden? It's becoming like fully integrated.
Yeah, but we are getting there, and we are continuing to grow. It's not like we're stagnating. We continue to grow in all the markets that we're entering. We see very good growth.
But how many
both here now and in
consultations do you have in
France.
Sweden? Like 20?
It's
30?
not as, you know, Germany is obviously the biggest primary healthcare market in Europe, but still it's a lot of consultations with doctors, even in smaller markets as Sweden.
So
you know, it's 10-11% of GDP
But
in
you
all
are
Western
below
European markets. It's a
1%.
really,
You are
really
below
big business.
1% of the consultation.
Sorry?
You are below 1% of the consultations, roughly.
Once again, that we
Below 1% share of the consultations.
in total, if you look into all the consultations, if you look into primary healthcare, we have a few percentages of all primary care. But if you,
you know,
look into
people
all,
told us 10 years ago we would never buy fashion online.
yeah.
And now it's like 35-40% of our fashion spend.
But this is just getting started, right? Yeah. We are just getting started. We are starting to scratch the surface on the things that we can do.
So how can it grow faster? Or what can we do? I mean, apart from conference organizers raising the awareness, but David, what do you think society can do to help you to accelerate faster? Maybe the insurance companies can push it because they have an interest.
Yeah, but I think that this is happening now all across Europe. France is a very good example of this. We entered 5 6 weeks ago. We hadn't had presence there for more than a year. We're covering it for 2 years, but regulations now are changing, and now you equalize digital healthcare with physical care in primary care with some limitations, but that's a really good example. It's a really big market now opening up for digital care. We're pushing it. I mean, of course, we have been in those conversations pushing this forward. Same in Sweden. There were no one to, we have been running plenty of different models and pilots with, the public system to make sure that we can push this model forward.
I think collectively we've seen much more change in the last 6 months than the last 6 years, and I think pressure is coming from consumers. Consumers are not putting up with it, and they're doing private pay, and this is why our service is popular. But over time, we've seen now Germany reimbursing video consultations, and they will also reimburse.
What's the reimbursed part of your business? If you look at your revenues, how much is being paid?
It's very, very little. So in general, healthcare is 10% of GDP, and 90% of healthcare is statutory, and less than 10% is private. And so when you use our service at Zava, you get an invoice, and you can bring the invoice to your insurance company. If you're privately insured, you get fully reimbursed. If you're publicly insured, you don't. And now,
so you are like a VIP health product.
Yeah.
But Babylon is like mass market, KRY is like mass market.
So
obviously working with.
I guess we've managed to win around 500,000 patients in Germany who believe this
with a good product.
With a good product, and this
also not wrong.
Expectations are now much higher than maybe 5 years ago when I started this, and people thought, that's crazy, we'll never do healthcare online. And I think the German regulators are now catching up. Yeah, UK and Sweden are forerunners, but I think in Germany, the type of consultations we all do will be reimbursed in about 12 to 18 months' time.
We are also running out of doctors also in Germany. We have a situation, I came from south of Germany, in some Bavarian countryside areas, there is no medical doctor available. So they had to drive 30 to 50 kilometers.
That's the original, I think, reason for Babylon to
we are moving to the India or African market. So it's now it sounds funny, but really we definitely will have.
But you know, this point of that you said we are moving into India, Africa, China market. Honestly, I spend a lot of my time now in Asia. And I get better infrastructure, better airports, better than I get in the West nowadays. It is very easy to close our eyes in Europe and think and sit on our laurels of what an amazing place we have been. But I tell you, the rest of the world is catching up so fast. Definitely. For companies like ours, the amount of return we have in Asia or in United States is significantly has been higher than our own continent. And I think that people, going back to this point about we are 1% of the market, 2-3% is irrelevant. None of these companies around this table will be ever competing with each other. The competition is not this. The competition is the real physical 99% who is out there, and none of us can grow at the rate, even if we take 20% of that market in 5 years, it means each of us has been tripling, quadrupling a year every year. That's what Reid Hoffman calls blitz scaling, and I tell you, there are not that many people who can blitz scale without losing their shirts, right? So, in any industry, full stop. For every one industry company that you hear has grown 10-fold, 100-fold, 1,000-fold, 1,000 have fallen, just not being able to manage that growth. So I think the real competition in healthcare is the physical old thing. Everybody else will grow phenomenally well if they can manage their growth. We'll all do very well, and that's why I'm focusing on we need to do so responsibly, profitably, make sure this doesn't become some kind of profitably. Because there is no business where I take my investors' money and just spend it all the time on subsidizing. Eventually, at the end of the day, you need to make these businesses be on the same ground, work on the same economics that the rest does, save money for everybody, make healthcare more efficient, more affordable, and put it in the hands of more people on the earth. Half of the world population has very little access to healthcare.
I can't wait to get sick and try all the apps which are there. Thank you so much.
Thank you.
This is fascinating.
All the best.
Thank you.
Thank you.